Thank you very much, Mr. Chairman. Thanks to the genius of American enterprise and innovation, there are many tools, more tools than ever, to keep our nation healthy. However, also growing are the threats and issues that jeopardize Americans' well-being. And we have to learn from the dark days of SARS-CoV-2 pandemic. We lost more than 1.2 million Americans in that pandemic, and still counting, with countless more impacted by economic hardship and long-haul COVID. With these health threats constantly looming, the time to start preparing is now. And that's why my colleague, Congresswoman Trahan, and I are partnering to reauthorize PAHPA, P-A-H-P-A, the Pandemic and All Hazards Preparedness Act. This legislation is critical to building durable national health security framework, and many of its authorities have actually lapsed. PAHPA provides funding for programs that enhance public health response, medical countermeasures in our strategic stockpile, and deals with emerging biothreats. A recent nationwide poll found that only 9% of Americans think that America is prepared to handle a biological threat. PAHPA expired in 23, and since then, the funding for the program has been haphazardly strung together through annual CRs that do not allow long-term planning or complete reauthorization. I look forward to working with my colleagues on both sides of the aisle to ensure our public health is fortified against these hazards. Also, reports are showing that Americans' emotional well-being is declining. Strengthening access to mental health is critical. I'm glad to introduce, for that reason, the Talk Safe Act, which increases mental health care availability for millions of Americans. 60% of the counties in the United States have no psychiatrists. 80% of psychotropic medicines are prescribed by non-psychiatrists. America's mental health infrastructure probably warrants an overhaul, and the Talk Safe Act is a step in that direction. Mr. Ulmer, you mentioned in your testimony the heart-wrenching statistic that more than 40 million Americans have dealt with mental illness in the last year alone, and even more are dealing with substance abuse disorders. How critical is it that Americans dealing with mental health disorders are treated by qualified medical health professionals, and do we risk exacerbating our drug crisis if prescriptions are not written by qualified professionals?
Well, thank you, Congressman Dunn. I remember not too long ago sitting and talking with you and sharing different war stories, so thank you for your service. Better mental health and substance use disorder care access is the need of the hour. And health centers are poised to deliver this care in every community across America, thanks to your support. The value of integrating, and that's the key thing, is integrating behavioral health services into primary care through health centers, is that our interdisciplinary team's approach can provide this care at the highest quality. So when I think about community health centers across this country, we look at this as a team effort. It is the provider, the behavioral health counselor, whether that's an LCSW, licensed clinical social.
Qualifications do seem to matter, though, to you as well, right?
That is correct.
Okay.
That is correct.
I'm going to reclaim my time. Dr. Brem, you're a fellow alumnus. I went to GW Med School. You talked earlier about ways in which important innovative technologies like genetic testing can help physicians detect cancers earlier, get patients on the right track as quickly as possible. I recently introduced the Facilitating Access to Innovation in Cancer Care Act, along with Congressman Soto, to ensure that the effective cancer treatments are appropriately reimbursed in Medicare Part B. How quickly has the cancer innovation landscape evolved, and how important is it that we continue to cultivate a reimbursement environment where innovation remains economically feasible?
It's very important because many a wonderful technology has not been fully integrated or integrated at all into clinical care as a result of the lack of reimbursement. Advanced care, precision medicine, which is what we're targeting now, is an expensive proposition, but is a life-saving proposition. So we have to be careful to make sure that wonderful science, the innovation of our country is not just a science experiment, but is brought to patients as well, and that requires support of these novel and life-saving technologies through
I agree with you, and my time has expired, so I'm going to dispense with the rest of the questions, but thank you, Mr. Chairman. I'll yield